Okay, what I did during the COVID-19 shutdown of spring 2020, I actually put together a series of problem sets for my students and bundled it together in a self-published book through Amazon. And that was actually getting it through was very difficult. The major self-publishing organizations wouldn't publish anything on COVID during the outbreak. So I put all the materials together. I designed the cover. I did all the interior, edited it as best I could, checked all my equations, did all that, submitted it. I got almost to the point where they were going to publish it. And then I got an email from them saying it was inappropriate content. And so I switched over to Barnes & Noble. I set up the book with Barnes & Noble. They have a self-publishing platform as well. And I figured I'd self-publish. And this way, if I used it in class, it'd be very easy to order copies for actually, I can get copies for $2.15. It's a very easy way to get copies of the material in a bound format for the students. So I got all the way to the end with Barnes & Noble. They even gave me a URL, and it looked like it was published. And then same thing, I got an email saying inappropriate content, and we reserve the right to not publish anything we don't want. So went back to Amazon, went back and forth with them, eventually talked to a techie, and I explained to some tech person on the phone, I said, this is really just a math book. I said, I'm not like an anti-vaxxer or a Trumper or a Bidener or whatever. It's just a math book. I said, there's nothing opinionated about it. So eventually I talked them into publishing it. And it took me about 2 months time actually to get that through. So, and this is the cover. Mathematics of Virus Spread for Beginners. There is some math in it, but it is not a real high-powered text. Some of this epidemiology shows up in graduate level. Some of the math shows up in graduate level courses and also in an advanced differential equations course. Here comes somebody else.
Well, my students were, excuse me, Jerry, my students were getting prompted for a username and password. So I think they found out that if they just copy and paste the link, it won't require them. So they were, sorry, a couple were late there.
Okay, no problem. So
yeah.
Are they in now? So
I'm trying, yeah, Maddie got in, so I believe mine are all in.
Okay, that's good.
Yeah.
Okay, thanks.
Yeah, thank you.
So I actually made a connection with a gentleman, Brother Joe Wilkowski, was teaching pre-calculus at St. Joe's, and he's still there, but this year he's teaching physics. And he used all my materials with his pre-calculus class. They went remote as well. And this is what he said. This monograph offers a well-designed study of how an epidemiological model is created, starting with a simple exponential model, progresses through more complicated yet more realistic models, developing one surprisingly accurate, etc. That's Brother Joe Wilkowski from St. Joseph's Collegiate Institute. I was glad he wrote this because after I got done, I wasn't quite sure what I did. And then Brother Joe provided this for me, and I said, you know, he provided a synopsis better than I could have. And so I was real happy with that. So he's a real nice guy. I gave pre-calculus students a choice. I said they can work on an electronic platform. Pearson or Hawks Learning both offered a free access for the rest of the semester, or do pencil and paper problem sets. And they would submit them to me, I would grade them. And they all but one, there were 17 students, 16 said they wanted to do pencil and paper problem sets with back and forth dialogue. They just didn't want that depersonalization with an electronic platform. So we all but one chose pencil and paper, and so I told them we'd work on something very interesting. So let's start. There's reproduction numbers. This has been in the media quite a bit. R0 or R0 is what's called a basic reproduction number. That's how many new infections each person will cause in a population with no immunity. In other words, no vaccination and no prior exposure. Now, a person potentially could have immunity because of prior exposure to other viruses, but not the current virus. So now there's another reproduction number, RE or RT, just depends on where you look. UK uses RT, and the United States tends to use RE. Or in the United States uses RT, and the UK uses RE, sorry about that. And that's how many new infections each infected causes during the progression of the virus. And of course, that will go down as time progresses. As more and more people develop immunity, it's more and more difficult for an infected person to find a host to infect. So R0 is static, it doesn't change, but it can vary from population density and social customs. So for instance, R0 for the measles is between 12 and 15. And we'll look at that later on. Each person with measles potentially could infect 18 other people. That's a very, very, very fast spreading virus. Now that doesn't happen because so many people are vaccinated or they had it, so it actually spreads a lot less quickly than that. So, but if you were to take like a city like New York City, for instance, and suppose nobody in New York City got vaccinated and a generation went by and nobody had any immunity, and you introduced one virus case of measles in New York City, that person would infect 18 other people very quickly. And that reproduction number is so high that a city like New York City would reach full infection in a matter of 2 weeks, actually. 2 weeks, 6-7 million people would all be infected. So that reproduction number gives us an idea of how not only how fast the virus is going to spread, but how big of a public health problem it's going to be. And that's also why the Native Americans had absolutely no immunity to viruses. And when they got the measles, it was catastrophic for them. It spread very rapidly. And during the Civil War, there was a lot of people that grew up out on the prairie, never been exposed to measles or possibly any other virus. And that was actually, measles in the Civil War was more deadly than bullets, believe it or not. So many people got infected. So here's a very simple illustration. If R0 is 2, that first column, we start with 16 infections, we go through one reproduction cycle, it could be a week or so, and then we have 32 infections. Another reproduction cycle, we have 64, 128, 256, and on and on and on. And if R0 is 1, well, we have equilibrium because every person that's infected gets replaced by one more infection. And so start with 16 infections, you go through one reproduction cycle, you have 16, 16, 16. And incidentally, we'll talk about this later. COVID last summer, most states had a reproduction number of about 1 for COVID. We basically reached equilibrium. So the number of COVID infections in June roughly equaled the number of infections we still had in August. And that's despite social distancing and taking extreme measures that we did. So R0 equals 0.5. Basically, as we go through reproduction cycles, it gets cut in half. So you start with 16 people, they infect 8, and they infect 4, they infect 2, and then 1, and then it dies out. So when they talk about herd immunity, we get enough immunity so that reproduction number dips below 1, and then it dies out. So now here's a plausible scenario. An average flu in November will have a basic reproduction number of about 1.5. And that would actually be also the effective reproduction number at the beginning would be the same as the basic reproduction number. We give out flu vaccines. You go to Rite Aid, they bug you. Do you want the vaccine? You go to your doctor, everybody's trying to stick a needle in your arm. Well, the public health people, they're trying to get as many people vaccinated, not just to protect you, but to lower this reproduction number. And through vaccination, it's quite possible that the reproduction number is lowered to 1.2. And by February, sometimes the hospitals are stressed. We actually have had, in Western New York, there's been times when the hospitals are booked. There's like no hospital beds because of the flu. You don't always see that, but it's one reason why they vaccinate very heavily for the flu, because they don't want the hospitals to be overbooked, because then, you go in with a broken leg or broken ribs, and then they hand you a little opium and say, well, come back in a month. We don't have room for you. They probably wouldn't say that, but the more the hospitals get booked, the more serious your illness has to be to actually get a bed. People don't always realize that, but they kind of self-adjust things. And so then we have infections recover as antibodies, and the effective reproduction number maybe goes down to about 0.8. Spring comes, we have natural social distancing in the spring, and RE is lowered about 0.5, and then the flu dies out. And that's a normal cycle of things. The flu vaccine is not necessarily to eradicate it, but it's to lessen the blow that the virus has on the hospital system. That's one of the primary reasons, actually. And if we didn't vaccinate, the hospitals would be a lot more stressed. I mean, we could potentially just build more hospital beds. It's entirely possible, and then we could let the virus run its course, but health insurance premiums would go up quite a bit. And instead of paying, instead of a good healthcare policy costing $18,000 a year, maybe it would cost 28. So and people wouldn't like that. So it's kind of a balancing act that they're doing. Now, COVID, the reproduction number for COVID is greater than the average flu. We'll talk about an estimate in a minute. Most states had an effective reproduction number for COVID of about 1 last summer, despite large numbers of infections, recoveries, and extreme social distancing. So we could only get it down to 1, despite the fact that, what went on last summer? Everything was closed. People are wearing masks. People are taking precautions. Not everybody, but still, those precautions got it down to 1, but the normal flu by then just disappears. One reason why the reproduction number of COVID is greater is because we have a lot less immunity to COVID because of exposure to prior viruses. It's called a novel coronavirus because it's unique, and so that's one difference. And of course, we have a higher reproduction number. It spreads more rapidly. So, here's this is an online journal called Plus One. This is from last November, and these numbers are probably still pretty accurate. They summarized. They provided like a meta study of 29 different values for R naught for COVID. And they had a mean of 2.87 and a 95% confidence interval of 2.39 to 3.44. So they're basically saying they're 95% sure it's between 2.4 and 3.4 roughly. Now that's a lot higher than 1.5 for the flu. Country high is 6.32 in France, and the absolute high, 14.8 Diamond Princess cruise ship. I would not want to be on that cruise ship when the flu broke out. So of course, you're very confined in a confined space that spreads very rapidly. So this is what really scared the epidemiologists at the beginning. Initially, they thought it was actually less than this, 2.2 or 2.3, but that elevated reproduction number, the epidemiologists knew this is going to be much more serious than the flu, and that's why they really were alarmed. Here's an interesting formula for herd immunity. Well, the next slide we talk a little bit more basically about it. 1 minus 1 over R naught. This is the percentage that need to be immunized to reach herd immunity or equilibrium. This percent will drive the effective reproduction number down to 1. Now for measles, if you assume a median value of 15, you plug in, you have to have 93% have to be immune to shut down measles. Now, that's not much of a problem because growing up, we didn't have a vaccine, but everybody got measles. So pretty much every adult in our population had measles. It was just kids that were coming up that were going to get it. So it didn't spread very quickly, but nonetheless, the kids did get it. Nowadays, we have a vaccine. We probably have much better than 93% immunity. But sometimes if you end up with a whole cluster of kids that aren't vaccinated, a whole community decide not to vaccinate, which is certainly their right. One case of the measles gets introduced, and it goes through that population very rapidly. It's very quick, and so using an R-naught of 2.87 for COVID, we'd have to immunize about 2/3 of the population, and you've probably even seen this figure on the news. Dr. Fauci has used approximately this figure. It's pretty high. For the flu, 33%. For COVID, 65%. It's a big percentage. And that's also one reason why it'd be very difficult for us to reach herd immunity just by infection alone. If we said, let's go have COVID parties and swap spit and hug and let's try to like tough it out and get through it. Well, you have 2/3 of the population potentially would have to get sick, and that would be very difficult. So of course we didn't have a vaccine. With the flu, 33% is easy to achieve for the flu through vaccination and infection. And so another difficulty with COVID is let's suppose last year we infected 2/3 of the population. Okay, then we get mutations, and then the next year or two, guess what? We got to start all over again. So it may keep us potentially ever sick, unfortunately. So here's another way to look at it. At this herd immunity formula. If R-naught is 1, if you look at the top row, then we would need no vaccinations to reach equilibrium, because one person would just infect one person. But if we have 2 people, if we have R-naught as 2, we'd have to vaccinate one of those 2. So that's basically half the population. Now, if you get on to 5, for instance, R-naught is 5, well, guess what? You better vaccinate 4 out of 5, so that way each person will only find 1 host instead of 5, and it's 80%. So R-naught is 15, you're going to have to vaccinate 14. And then 1 person can find 1 person to infect. And that's a simpler way of looking at this. So any questions with any of that so far? No questions? Well, now we're going to go on to COVID models. There's some difficult equations in here, but just if really highfalutin math gives you the creeps, just look the other way. Viruses spread exponentially, don't they? People say this quite a bit. Well, and lots of people I meet in the street, well, they spread exponentially, don't they? Well, sort of, but not quite. The assumption of exponential growth is rate of change is proportional to the number infected. And that sounds plausible. But here's an interesting graph. When COVID started last February, at least the start of the count, it was doubling every 3 days. And if you follow this graph, after approximately 100 days, we end up with over 20 trillion infections. Okay, that's 20 trillion. Now, there are only 7 billion people in the world. 20 trillion is 3,000 times that. So in order for exponential growth to keep on going, we'd have to bring a lot of alien populations in to keep our growth going. Eventually, we run out of people in a hurry. So that's what initially, the earliest stages of a virus, it looks exponential, but that goes away pretty quickly. So here's one way that we could keep the exponential growth going. If every time a person gets infected, we have to let one Canadian in. Okay, we could open the borders, just let one person in. We keep on replenishing that supply. So we just say, hey, we want to be friends, come on over here, eh? And and we could keep the exponential ball rolling, so to speak. If we run out of Canadians, we'd have to go to Mexico and then Tijuana, and then eventually we'd have to invite all of Europe over here. So problem is the number of susceptible people, the number of people that could be infected decreases with time, so that stunts the rate of the virus spread. Now in precalculus, here's an exponential growth equation we do in precalculus, and then also in differential equations, we do this equation. We don't need to go into differential equations, but the way math is set up, in precalculus, we learn how to use the equations. Then in differential equations, you learn how to derive the equations. So and normally students that go on to differential equations, those are students that are interested in some serious STEM, and it's worth their while to understand where all these equations come from. So that's how it's situated. And here's an interesting relationship. That exponential growth R is equal to R naught over tau, where tau is the infectious period. This is the simplest way an epidemiologist can estimate what R naught is. They could just multiply the exponential growth rate. You could fit a curve to it in the early days. You could use exponential regression. The graphing calculator has that utility. You could figure out what R is, measure the infectious period, multiply those two, and it gives you R naught roughly. So it's not that difficult, actually. The difficulty in measuring it is not this simple math, but it's in figuring out how the virus is growing, because normally you can't see the virus in people, and so you may be able to measure reported cases, but you're not seeing the full extent of the growth. So it can take a lot of epidemiological cleverness to try to figure out what's actually going on. Unfortunately, epidemiologists do studies. They don't necessarily do experiments, although scientifically they're called experiments. But if the epidemiologist, if we could round up 100 people, put them in a room and watch the infection spread, that would make our math a lot easier. But we don't do that in this country, unfortunately. So that's part of the plight of the epidemiologist. It's very, very difficult for them to come up with great math. Physicists have it easy. Now, you may not think so if you've ever sat in a physics class, but they measure the behavior of electrons. Electrons behave like they should. Epidemiologists have to deal with the behavior of people, and people don't behave as they should. So that confounds the issue in many ways. So now here's an improvement. It's called logistic growth. We assume the number of new infections is proportional to the number of possible interactions between those who are infected and those that are not. Now that's a pretty reasonable assumption. You have 10 with it and 10 without it. There's 100 ways they could interact. And that's really what drives the spread of the virus. It's got to go from somebody that has it to somebody that doesn't have it but can get it, that doesn't have any immunity. And the problem with logistic growth is once infected, always infected. So it's a fairly simple model, but it has that limitation, because what happens when you're infected? Normally you get over it, you develop immunity. So we're part way there, but not quite. Logistic growth is also called the susceptible-infected model, or the SI model. It's the simplest compartment model. And I tell my student it works well for bacterial infections and a zombie apocalypse. So, and supposedly that's a bacterial infection. Once you become a zombie, once a zombie, always a zombie. And I've actually been told by students that the Niagara frontier would be the epicenter of a zombie apocalypse if it ever happens. So in the event that happens, I have all the equations. So just come get me and I'll predict what's going to happen. So Here's a simple scenario. In the lessons my students did, I had them do this simple math. And it seems, when you're going through the material, I made sure I went through the simple stuff, because if they understand the simple stuff, then the more complicated stuff falls into place. So if you have 1 infected, 19 susceptible, suppose we have 20 people, 1 times 19, there's 19 possible interactions. And you can follow it down in the middle, we have 10 and 10. 10 infected, 10 susceptible, 10 times 10 is 100. Obviously, if there's 100 possible interactions, it's going to spread roughly 5 times as fast as if there's 19 possible interactions. So this is what governs the rate of spread of the virus, is how many interactions there are. Then, of course, we get past that hump. To get all the way down to the bottom, you have 19 infected, 1 susceptible. I wouldn't want to be that person. But the rate of spread is decreased. Then, of course, 20 infected, 0 susceptible. Well, we've reached our goal, no new infections. And that's basically logistic growth. Of course, we have all sorts of equations we can put to it, but you can go through and do some of this by hand. What I did for my students, I made my students fill out some of these charts. The first 3 columns are what we just talked about. And I said, there's a proportionality constant. And I said, let's C equal 0.01. And that proportionality constant has to do with how fast the virus spreads. Later on in the course, I actually show them how to calculate that. But for now, I said, this is just a number that dropped out of the sky. If C is big, it spreads very quickly. If C is small, it doesn't spread very quickly. So I said, just take that 19 and multiply it by 0.01. Then you get 0.19. Multiply 36, you get 0.36. And so that gives you infections per day. So we'd have 0.19 infections per day, and then 0.36 infections per day. And then it said take the reciprocal. That gives you days per infection, if you like all this dimensional analysis. And then you can actually model the virus. It takes 5.3 for days for the first infection, 2.8 for the second infection, 2 for the third infection, on down. And it speeds up because it takes less and less time, and it slows down. And then I had to make a column there, cumulative time, and then they can see it's 35.6 days for full infection. And so, and it's a pretty simple algorithm they're following. They're just following a procedure, but I made them do it all out by hand because they developed some pretty good insight as to what's going on. And believe it or not, I told them they actually numerically solved an autonomous differential equation. That really impressed them. And if you take a course called differential equations, then actually this numerical work kind of makes the differential equations make sense. And I had them do this numerical work, and they could see the effects of social distancing, what it means to flatten the curve. And also, this is a good precursor for understanding what's called the SIR model. Once they go through all this basic computation, then what we do later on makes sense. Then it did make sense. I had 17 kids work through the SIR model. 100% of them understood it, believe it or not. They worked through it all successfully and understood it. So, but it's because of a lot of this preliminary work that made them understand it. So there's an interest, just a simple graph. Exponential growth is red, that takes off to infinity and beyond. The blue curve is logistic growth, and you see it levels off. And if 20 is the maximum population, it kind of stops. Theoretically, it approaches that asymptotically, but if you look at 20 actual people, it actually reaches that. So that's also called an S curve. The S curve is useful outside of virus growth. It's used a lot in finance and marketing. And right in the middle of the S curve is what's called an inflection point. And that's pretty important. That's a calculus concept. And in In the stock market, in investing, you hear this on financial news networks. They're always talking about inflection points, because if you're going to invest in a stock, like in an IPO, you want to invest before the inflection point. That's where all the growth is. You get past the inflection point. Those are the big companies like IBM. You know, they've already experienced all their growth. So, ironically, I used to talk about logistic growth and virus spread in class. This is an interesting thing that comes to mind. And I used to tell my students, we got great public health in this country. It's the best. And I said, if there's ever a pandemic, our government officials know exactly what to do. That was a miscalculation of the century. I think we know what to do. And what's interesting is South Korea has gotten a lot of their medicine public health from us. It was interesting. And I think we know what to do, but it's kind of like teenagers. Teenagers know what they're not supposed to do, but it doesn't always work. So, any comments?
None.
Yeah, I was flabbergasted, really. My daughter, who's my oldest, actually has a degree in public health and worked as a health inspector for a while. And some aspects of public health is very good in this country. But responding to a pandemic, we're not very good at that. That didn't quite work. Here's a bunch of equations. Most people don't.
Maybe, Jerry, once we have a few.
Yeah. By the third one, maybe we'll get there. South Korea, a lot of social discipline in South Korea. You know, in the way back in March of 2020, actually, I went to Home Depot and bought was remodeling my bathroom, which I'm still remodeling, actually. Went to Home Depot. It was in the very earliest time. I think the pandemic, it wasn't quite here, but it was going to be here in a couple of weeks. And one of my students works at Merck, actually. He's a mathematician there. And he actually did an interesting geographic mathematical model, and he sent it to me. And he told me that the COVID that hit the East Coast is going to hit Western New York April 15th. And he was correct, plus or minus a day, I guess. I mean, he's a pretty bright guy. But in any event, I went to Home Depot up in Erie County, and I can't remember if they said we were supposed to wear masks or not, but there was 3 Oriental gentlemen came into Home Depot. They had masks on, nobody else did. You know, so I thought that was an interesting signpost. You know, they were planning ahead, I guess, but it took us Americans a while to catch on. So let's see. And this is, I think I talked a little bit about this before. Formerly, I went through these equations in Precalculus to apply it into a variety of situations. And but instead of applying it to a variety of situations, I just decided to do virus spread. In Precalculus, it doesn't really matter because, like, we're not teaching content necessarily, we're teaching math. So, you know, in chemistry, you better apply your equations to chemistry. If you're doing economics in chemistry, you're doing something wrong. But in math, we're more interested in the generic math, and we do applications that add some realism to it. So. The SIR model, this is pretty important. A person's either susceptible, infected, or recovered. It's what's called a compartment model. You're in one of those 3 compartments. And so in the way the model's worked out, once you're recovered, you stay recovered. Now you could potentially take some of the recovered and move them back to the susceptible. If you do this discreetly with the spreadsheet, it'd be a very easy fix, but that's not normally what we assume. The rate of virus spread is proportional to the number of possible interactions between those susceptible and infected, same as logistic growth. So you see, if the kids go through all that simple logistic growth, they carry that knowledge into the SAR model, and it's not all new. They're just adding incrementally just a little bit more information to it. The only difference is the infected population recovers at a rate defined by a definite period. And if the infectious period's 5 days, every day 1/5 of the infected population recovers. So, and once recovered, a person's no longer susceptible. That's the SIR model. Of course, you have to put it to equations. Here's the Sir differential equations. I've seen this before, and I've solved these systems of differential equations. But that's way out of reach for my students, obviously, because this is pre-calculus. These are college freshmen. They wouldn't understand this. But now what's interesting is if you look at that top equation, that S times I, susceptible times infected, that's essentially that column we multiplied. So if they've gone through that column, these equations, if they're in differential equations, they make sense. Down below is S times I, that's the same column, and then we siphon off the percentage of the infected. So if they've done all this numerical work, these equations aren't so foreign, actually. They're just not a bunch of gibberish like you might see on a Big Bang Theory episode. So, so what I did in pre-calculus is what's called a discrete solution. Here's all the basic variables. Now down the second from the bottom, the S times I is that column that we had in the logistic growth. And this R naught over tau times S of 0 plus I of 0 plus R of 0, that's actually C. I say that's how we take the epidemiological variables and we can actually calculate what C is. And they know what these variables are because we've already done other calculations. And so they say, oh yeah, that makes sense. And so I have them calculate that C. And in the bottom, 1 over tau times I of T that's like 1/5 of the infections recovering each day. So by the time they come into here, they've worked with all these variables. And so it's not just a big hairball of Greek. So, and I have my students fill out probably this exact same chart. We started with 490 susceptible, 10 infections, no recovered. And you can see that calculation, 490 times 10. And I had them calculate that R naught over tau times all that. That's 0.00112. They calculate that beforehand. And this is basically my C times S times I. It's the same calculations they've done in the previous one. So we end up with 5 new infections. And we had 10 infections in an infectious period of 5 days. So 1/5 of 10 is 2. So we have 2 recoveries. And then we go down and we update all of our variables. Day 0, 490 susceptible. Day 1, 485 susceptible because 5 got infected. 5 left the group. Day 0, 10 infections. Day 1, 13 infections. We added 5, subtracted 2. That's how we got that. And the lesson I gave them actually had arrows drawn out showing them where to put everything. So I had it diagrammed really nicely. Of course, the recoveries go from 0 to 2, and then they calculate, and update it again. So I had them go through 5 days to get the basic idea. If we were doing 120 days, we'd build a spreadsheet with Excel. Let Excel do all the calculations, obviously. Nobody would do 120 days by hand unless they were insane or had a terribly boring life. But that's why we have cool technology for. So, but if you if you go through just a few of these days, you understand precisely what the model does. So I couldn't find this discrete version anywhere, by the way. So I worked out that coefficient R naught over tau, blah, blah, blah. That I figured out what that had to be. The closest thing I could find was there was a graduate course in epidemiology that did a discrete version, but they said just put a C there and assume C is, kind of what I did. They waved their hands, but they didn't really get down to the brass tacks of what the coefficient was in terms of R naught. Well, I had motives. I wanted that R naught to be built into part of my model. So Now here's some spreadsheets I drew. Let's suppose you have R naught of 1.1. That's a very slow moving virus. This actually looks linear. It's an exponential growth curve, but with a very gradual change. And you can see after 90 days, what do you have? A couple of hundred infections. Start with 10, a few months goes by, you have 200 infections. Like, woohoo, it spreads at a very unnoticeable rate. Now, if you ramp this up to 1.8, which a fairly fast-moving flu would have, now then after 90 days, well, suddenly we have somewhere in the neighborhood of 400 to 450,000 infections. Going from 200 to 450,000, that's what happens when R naught goes from 1.1 to 1.8. So now you can see how that R naught affects what's going to happen down the road. And this is another thing that scared the epidemiologists. So they truly were scared about what was going to happen 3-4 months down the road. Now, if R naught is 2.3, guess what? Now we have millions of infections after 90 days. We've gone from 100,000s to millions. 2.3 was an early reproduction number estimate for COVID. So now we're looking at, 3 months down the road, 70 million infections. And that was like, January to April or whatever. And that's pretty scary. They were last spring, Dr. Fauci was talking about, I think he said there could be between 160 and 240 million infections. They were looking at some high side estimates of the reproduction number and what was going to happen in the future. And now here's 5.8. If you look at 5.8, then it looks like within 30 some days, we have full infection, 330 million people infected. Just a little bit outside of a month. I mean, that would be catastrophic. One interesting thing is, though, this high reproduction number predicts catastrophic infection rates. We probably never would have gotten there because as things get bad, people do react. Even if there was no government intervention, people do stay safe. If they started to see their neighbors dying, people probably would have sheltered in place and taken some precautions. So does that kind of make sense? I think people do take precautions if something serious comes. But nonetheless, that's what the epidemiologist is looking at. And that's also why it was such a difficult job to educate the public. The public doesn't see these equations. But the epidemiologist had to somehow get the message across about the seriousness of it. And for one thing, like if Dr. Fauci got up and started solving differential equations, he would have lost everybody. So I really feel for them. He couldn't say, "No, we're going to have our daily math lesson at 2:45. Take out your pencil and paper." That just wouldn't work. Governor Cuomo, I thought, did a pretty good job. All of his briefings, I thought he was organized. He actually followed the cue of some epidemiologists and medical professionals. They were basically telling him what to say, which is what he should have done. I mean, that's what the government officials should have done, defer to the experts. And there was a whole team of people from medical schools and whatever, and public health people informing him what to do. And he did exactly what they said, as far as I can tell. So any questions with that? So I generally don't discuss COVID on Facebook, by the way. So I stay away from that. And when people tell me all sorts of crazy things, I usually just agree. I nod and agree and walk away. So there's some improvements to the SIR model. It's called the SEIR, susceptible, exposed, infected, recovered. You add another period. Normally, when there's a period between uh, when you're exposed and you're not quite infectious, you're not contagious. And so that slows it down a little bit, but not much. And then there's the SIRD model, susceptible, infected, recovered, dead. That's a pretty depressing model. And that would affect things, obviously, because if you take recovered people and put them into the population, I mean, they're immune and that dilutes the population. So all your daily interactions are going to be with susceptible and immune people. But if you take all the immune people and you bury them in a cemetery, well, guess what? You're still going to be primarily interacting with people who are infectable or susceptible. So that's, you know, if you had a particularly deadly virus, like I suppose the plague, you know, back in 1200 AD, you know, the really high percentage of the people that got the plague died, you know, possibly because of the seriousness of the plague and poor nutrition and everything. So a more refined model would differentiate between virus spread in urban, suburban, rural populations. So epidemiologists actually quite often will use a computer model that would be a little bit more refined instead of just working out these equations. Now this is really interesting. I kind of followed this. There was two models put together, Oxford and Imperial College. And the Oxford model, they both used the SAR model, and they both made no bones about saying that. They used the exact equations I'm talking about here, except for a lady at Oxford assumed that there was high genetic immunity, and they assumed an earlier introduction. So Dr. Gupta at Oxford said it had been around since October, and there was probably a lot of genetic immunity. And she predicted, based on her assumptions, that COVID was going to disappear last summer. Now we know it didn't disappear, so guess what? The Oxford model was a little too optimistic. The Imperial College model, they assumed a later introduction and low or no immunity. Now that's a little more serious. That's what the public health officials adopted, was a more serious model. Now, it's not just because they're pessimists, but public health people tend to operate in the realms of worst case scenario. And so the Imperial model was a worst case scenario, probably not as bad as they thought. It's my guess is it's probably somewhere in between. Not as bad as the Imperial College model, but a little bit worse than the Oxford model. But it's interesting, if you kind of work through the SIR model and, you know, you kind of get an idea of what these people are talking about. And these people are dealing with reality. These are real people building real models. These are, you know, good mathematicians, and they know their stuff. One of the problems with these, there's a couple of problems with these models. I hear people all the time talk about the faulty models that the epidemiologists put forth, and oh, they're always wrong. You know, you don't know what they're talking about, and et cetera, et cetera. And that's really just a bunch of rubbish. It's two things. Any mathematical model somebody puts together, there's some assumptions they make, and it's going to be imperfect from the get-go. And second of all, we're taking a perfectly continuous model and assuming some sort of uniform behavior, uniform infection rates, and imposing it on a population. So there's always a discrepancy between our ideal model and what actually happens. Now, hopefully, those two come together and there's not too much variation. In the world of physics, there isn't much variation. You know, we can approximate things really, really, really well. We can send a spaceship to the moon, we can be off by 1 meter in our calculations. But a lot of the virus spread, who knows? We can't exactly predict the future, but I think the epidemiologists, when they said how serious it was going to be, that's the truth part of the model. They knew it was going to be serious, and it was serious. So they couldn't say exactly what was going to happen, but they knew it was much more serious than the flu, and that part was correct. Here's traditional pedagogy, Calc 1 to 3, differential equations, more theory, math modeling in the senior year of college, pre-calculus. I gave the kids a glimpse into the cyclical process of mathematical modeling. You keep on improving it, keep on improving it, keep on improving it. That's normally, they don't get to see that in pre-calculus normally. So I thought that was interesting to find a meaningful way to add something earlier onto the curriculum. And a little bit of history here. John Kameny developed a basic programming language at Dartmouth to do discrete modeling concurrently with calculus. He wanted to do this sort of thing in calculus instead of waiting till the senior year. And add on an extension of basic is visual basic. Lots of people have heard that term. And John Kameny was an interesting guy. He developed a basic programming language, and he actually became a dean at one time. I'm pretty sure it was him. Became a dean of Dartmouth College. He wrote a program to do his job, and then he resigned. He said these dean positions really are not that complicated, and really I can replace any administrative person with a computer. And they got back to teaching. So he's my hero. Yeah. And this is a little bit about what I did. Fall 2020, the night pre-calculus class was face-to-face, and I did a lot of this. I actually we met Monday and Wednesday night, and we go through, sets and interval notation, functions and trigonometry and everything. Well, what I did is every night we did, it's a long hour and 40-minute class, and kids kind of get tired of what I'm doing. So what I did is I saved about 10 minutes for the end, and we talked about COVID math every night. So, and kind of brought contemporary issues into it. And they really liked that. So we did a little bit all semester long. And then at the end of the year, then we hit it hard with SIR model and all that. So that worked really well. They really liked that. Most important of all, every student learned compelling reasons why we should follow epidemiologist protocol and keep us all safe. So, okay, any questions with that? That's a lot.